So it's Wednesday, August 17th. I'm in this at the moment. I actually put braces on my knees from the local health store because the swelling um, is more than it was, and I'm afraid of the impact. So I did that. The other day, I called the health insurance for one thing to get the name of a specialist um, because the hematologist that they sent me to that gave me the list of results being that my platelets are high and like these legend like a legend to follow of cryptic numbers and associations and things that I'm trying to follow along, but it's like a specialty just to try to figure out what information I need and what questions to ask from the doctor. I mean, I really didn't think it was, I mean, why does it fall on me? Aren't they the ones that went to school for this? But again, here we are. So there's been some baselines that have been established, and now I'm going back, but not till next Friday. In the interim, um, the again, if I think of my knee joint like a hinge, somewhere the weight bearing portion between muscle and connective tissue at just the superior side of the anterior of my knee joint or articulation um, is so it's painful, but it just doesn't work, and then it's swollen, and it's not functioning. It's hard to bend, so, and it's progressively getting worse. So anyway, so I put a knee stabilizer on both sides, just so I could make it through a walk today. um I wound up calling for physical therapy, but the thing, like, I finally got through to somebody who took the insurance. So I made an appointment. So now I'll go and attend that to see if I'm missing something or whatever that's about. But where I'm really having a disconnect is the hematologist gave me the name of something. Uh, she said she was a urologist gynecologist. And I'm like, no, that's an interesting combo. Why would you say that? And she's like, well, that's part of like the gastro, like, I want you to see a gastroenterologist and this urologist. And I'm like, right, okay. So I called, but the urologist that she gave me doesn't take my insurance. So then I had to call the insurance to find out who else takes it. And for whatever reason, the insurance, even though I spent a long time on the phone with them going through some stuff, um, they gave me a urologist for male sexual dysfunction. So after going through all of the phone menus, and I'm like, so I call the number that they gave me, and it's just like, it is so frustrating when you have so little like mental capacity and like due diligence and like desire and motivation to get these things accomplished, and then to hit all this inefficiency. What? I mean, like, I'm not in my 20s anymore. I'm not built and I'm not functioning. I'm already in a dysfunction. Where's a medical coordinator? Where's a medical service that lines these things up and then boom, here's your appointment list? Like concierge at this point. It's ridiculous. So I'm thinking to myself, I'm like, all right, so I have this, I can ascertain just on my own five senses some form of ammonia imbalance. I've taken anatomy and physiology. I'm fortunate that I have, because I'm thinking, I asked Lynn and Lou, I was like, what would you say to do? And they're like, they don't know. So now my questions are, I'm not in the medical field, so is it I mean, like Lou and Lynn would use the word kidney if it's, but I don't, but they wouldn't even, I mean, if I had to ask them, that would be the body part. But in taking anatomy physiology 1 and 2, I know it's renal or nephrology. It's one or the other. I get that. But the tricky part is I don't know which one to go to or to make an appointment with. And then they throw in their urologist. And I'm like, what the hell's the difference? I'm having an ammonia imbalance. Which one of them do I have to make an appointment with? Because my patients are really, really short. And my fuse is very, very short. And I'm not getting the answers I need. And this is absolutely ridiculous. Why is it that there's so many people that pass some boards of medical profession, yet, and they have all these little compartments, but none of them are effective or efficient and only stress out the patient more and more? I mean, I'm fortunate because of my situation that I don't have copays and things at the moment. But I've been in a situation where I do have to pay copays, and then I'm like, I don't even want to go. I don't want to spend the money. I don't have the money to spend. So now that stumbling block's been taken away, and I'm using it as though I was paying out of pocket. I'm like, because I know how I like socially responsible, because I'm paving a way of my necessity, but my kids inherit at some point. So like some of the I'm trying to limit the amount of mistakes my children inherit from my generation. So I'm thinking of it from that perspective and stepping stone. So I don't know where to book an appointment. I mean, this is a complete disconnect. It's an ammonia issue. It could be renal nephrology if I had to narrow it down, like if I was taking the boards on an exam and that was one of the questions. Urology is, I mean, it's not, I don't believe it's pelvic floor related. So, um, so this is frustrating. Then I'm ready to book the appointment for physical therapy. And my son calls physical therapy kinesthesiology, but I don't even know what, like, is that sports medicine? Because then I guess it doesn't relate. I don't really know. Um, so my so I'm thinking osteopath because I'm having a like muscular skeletal issue between the tissue and the bone. So I'm like, is that osteopath? Because it's osteo, but then it's skeletal. I don't know. And Lynn chimes in, orthopedic. And I'm like, ortho? Isn't ortho like buccal? Like, isn't, I mean, NPOPO. I mean, it's medical shorthand. So it's confusing. And then I'm thinking it's the mouth foot, like that in orthopedic for pedic. I'm like, it is so, I mean, and again, I think about this stuff, but like when I was I mean, like at 18, I mean, I wouldn't even know where to begin. I'm like, I need a kidney doctor, I guess. I mean, I wouldn't even know to call a kidney doctor. I wouldn't know. I mean, and that's the whole thing. It's like, it is so frustrating. And where's the bridge between the public that knows nothing except what their own issues are and the healthcare that they need, and then these so called professionals that studied it and took an oath to help and not harm when the process is so stressful. I mean, and it actually, it is harming It's harming at overcharging the insurance companies, wasting people's time. I'm, it's so frustrating. I mean, it's such a broken system, and I feel like it's just busy work. I feel like it's a full-time job. How am I at 40 when I'm having a major health crisis? There's no money to fall back on. There's no supplemental income. There's no insurance company to ask to pay for like supplemental benefits while I'm trying to nurse myself back to health, and then trying to traverse the healthcare system that they have provided or have built in some way is so frustratingly confusing. I mean, it's time consuming, and it's just, it get like, I've been going through this since my 30s, and it's progressively gotten worse with no answers and no getting better. It's just gotten worse. It's been stacked issues. And it's like you just keep going back and forth between insurance companies and having to find work, then kids, and so on and so forth. I mean, and then I'm thinking in like overall big terms of being part of a trinity and them completely messing up the paternity part of my trinity, or at least on first visual whatever, and forcing a POS onto my genetic lineage. I mean, like, this is a major issue, and it's on top of all this busy work. And it's like, I just feel like nothing ever gets fixed, and it just gets worse. And then it feels like it's by some intelligent design at some level, just to like not take responsibility for what they've done. This morning I saw something on the news. Two families, they refer to them as mob families. Again, I've heard that term loosely thrown around. No real clear definition on it, since, like, I mean, I'm just like a shutaway or like an isolated case of something else that nobody quite knows how to handle. And then one of the names ties back to something else that happened, and I'm like, but then they were mentioning today, outside of the ordinary, something about soccer clubs. And again, I don't know if there's like an internal war between soccer and football clubs. Like, again, I have no idea. It just makes sense in the stupidity of humanity at this point, and what, like, one avenue of wasting everybody's time and what they fight over, in the like psychology of a city, not just the individuals, but the city, because there's like a multiplex of complexion and complex issues, which I don't take for granted. I actually try to stay away, and I try to be cognizant of all of the different flavors of New York. Without getting directly entangled into any of them. But that's the update. In I don't know what the difference between an osteopath and a orthopedic is. They have some professionals that have a DO at the end of their name. No idea what that is. Is that like a doctor officer? I mean, like, is that like the militarized zone or trained? I don't know. And what's the difference? Because then there's an MO, the medical officer, and then there's the MD. That's what usually everybody. And then somebody's got an FACS. I mean, how are you even as a normal, like, I just got hurt, I just need to get fixed. Like, where do I go? Why do I have to go into the store, pick out all the parts I need, and then buy them and then carry them to the mechanic and ask the mechanic if these are the correct parts, and like, can you put them back together? I mean, it doesn't even make sense. You're just supposed to drive your car into the mechanic and say, hey, here's what's wrong with the car. I mean, why doesn't the doctor's office work the same way? It's so frustrating. I mean, as far as setting expectations, it's star 1978, star 8378, Nicole Cattaruzza, it's Earth, solar system, Milky Way universe, galaxy is broken, and it's Bayside Station, Bayside, New York, 11361.